Gold Coast Medical Foundation has organized fourth clinic programs to support the special children with the Cerebral Palsy Challenge, which has been the cornerstone of their well-being.
Okay, we have so many difficulties. For instance, accessibility to school, medicals, and all that. And for instance, I'm saying this again on air. This is our fourth clinic in the past years. We've always taken our letters to the Ministry of Gender, Social and Children and Social Protection, and they have never looked to our direction. You and I know that this program is actually supposed to be organized by them, but we, the parents of Cerebral Palsy Ghana, have decided to do our own program. At least they should come and then honor the program and tell us something about what they do in their ministry. For the schooling, we have the Ghana Education Service. Now they are doing something we call the inclusive education, which is good. Some of the children are going, but all the same, I feel they should adequately be ready for them, because they are going, but we don't really know what they are learning in the schools. So they should either tell us the learning materials, like the rest are buying books and other things, so we provide for our kids, or the government should provide it for them, then they will learn with it. At least they should learn a skill. Most of them can't read, they can't write, they don't do the science, maths, English, and so on. So at least if they are able to do a skill, they will be independent one day. The burden of being a parent with a special needs will come down. Then they will do something to help themselves in life, to get money. There are others who are also going through the same situation, and even worse. So today I feel the children will be happy. Aside that, they can't take them to public places. As you can see, the ambience alone is so beautiful. We have a poolside and everything. Just seeing these things, some have not even seen them before. A mother can't even take a child out there to a restaurant because people will just be looking at them. But here, you are here and then you are having a good time. So we are praying that more people should come on board, individuals, other NGOs. We need a lot of support. Now that we have started, please come and help us. We can't do it alone, please. We are asking diaper companies to come and join us. Some of the children are about 15 years, 16 years, having their menses, doing everything in their diapers, and their parents are still providing. Some are even using rags, which are giving the children infection. So if we get diaper company, and there may be places like Nestle, Cadbury, some of them are still taking solid food because they can't swallow and all that. We need people, a lot of people, the medical institutions, and even the pharmacies. I know we have Entrance and the other people who also produce drugs. They can come to us. Maybe they'll have a small pharmacy. Maybe every month I can give you these drugs for free, or every quarterly, or every year. They are corporate social responsibility. We are registered association. So when you come, we have certificates to help you. So you have tax exemption. Please, every hand on deck. Don't stigmatize us. It can happen to anybody. This thing is not hereditary. It is not a sin my father has done, or my great-grandmother or my great-grandfather has done. My son had neonatal jaundice, and look at me today. I have lost my job. I can't do so. And most of the parents too are in the same thing. And also the fathers. Last week Sunday was Father's Day. We celebrated you. Those fathers who have been leaving the mothers alone with their kids, please try and support them one way or the other. All we need from the public is that just love us for who we are. Love our kids for who they are. It is no fault of theirs or ours. We beg you. If I'm walking alone without my son, you are happy to see me. But immediately you see me with my son, then you look at me with a different eye. You sit in the public transport. This is a personal experience. I was going to the hospital with my son, and then the church mate was telling me if I couldn't pay the seat beside me, then I should alight from the church. Then he can load his church. Look, maybe the parents won't be able to afford. Then the parents will have to come down, not taking the child to preschool, which is going to destroy the children. Let's love us. It is not a contagious disease. It is nothing. Just come close to us. Give a child a smile. If you live by a child like that during Christmas, don't judge. Just do something. Get a biscuit or something and just go and give it to the child.
Me organizer Cerebral Palsy Ghana. Na ne motanti a ye di ade ato yanim say me so me a mother. Me ba ne 15 years now. Na ye start ne ye hu say mothers be brave na kwoti biamu a in fact din. Na more of anso say ye hia na say ye ya wo hu say nkrofo free outside. No mo abetwitwa a picture no mo di ko no mo di edin akojiska at the end of the day no ye hu omo nti ye di hu atun say mothers nyina be come together say ehia bibia yanka say be go out na ya kasa nti ya boa mothers na nyina na ya boa hu ye mothers more than 300 ye was cerebral palsy any be man nyina nti ye stress omo so mo outside na mo cerebral palsy no me ka ye hu ade ade kesi akọ echi pa na Gov'T Foundation omo do omo ato every year bia omo be clinic maye nti yensu ye sere Ghana for say at least every 3 months no mo timi ye maye yensu ye bedu ba bia omo so omo adu no ye da mo ase.
The challenge we the parents are facing, if you have a child with a cerebral palsy, it's difficult for you because there's no money. You spend all your money on drugs. And what I will plead on behalf of my fellow parents who have cerebral palsy, that the government should help us. When you go to hospital, their medication should be free. The government should provide the parent, the child with a medication so that the money that we will be spending, we can also use it for another thing. If not so, every parent cannot afford to hold a child who has a cerebral palsy.
When you go to the hospital, what are the experiences you meet? Are you treated as other parents or they give you a preferential treatment?
When we go to the hospital, you can see a cerebral palsy patient is neglected. They won't attend to you, and when they come, the medicine that they write to you, when you can't even buy it. If you don't have money or you are not working, you can't buy it. So what I will plead is for the government to take a look at it so that he will help parents who have cerebral palsy children. For every parent, if they can do something about it, it will be very good.
Let's talk a bit more about today's event. How do you think today's event, the support that is being given to you, in terms of addressing some of these gaps?
It's so amazing. It's so amazing. This is my first time coming to a program like this, and I'm overwhelmed with such a program. We thank the organizers for what they have done.
Me a CP mom as well. To take care of this CP child, enye ejuma kitwa kra, because akola papa ejame ho, ejani jame because of akola ni condition nti. E mami nkwa mi bra wa akola we hu saa. Sese ani ebe dimpo mi cousin bi na ebo ayen. Na shese how ni amanie si na ebe ya metimi di akola we akọ hospital krampo for medical attendance krampo no mintimi physio mintimi chese how bre enya sem kitwa na chese wo papa we watimi aja akola we atumi nkwa su ama chese bra na me bre ni akola we se awufo bi fathers na mo out no na se muni oba be wo ba na akola no akoti bia bi se mu mi se akola mankoji wonsuo ho mankoji no bebia susu no akola bi koti bia bi se mu a yesi oyebosomba oyensuo ba sense papa ni pese o mi nkoja akola ni kwan na me mama ho kwan ti no watimi adwane eja akola no atu me nkwa
osi koja akola no kwan chechemu
chese me like if you come for nyankwa nka ya wo nipa ne because akola we no owe a oti ho no den na obeba abeye na me so no usu no ne mi na da enyimu ye na me wu akola we eye delay na edi sa condition we ebre akola we nti say because of that man yes anti no we dwani eja akola na to mi su be say 8 good years ni say akola no 11 years baby amida krampo mu be hwe baby amida mu ankasa no ebeye hweyi ni chese eho nye kura emfa ne hu me ka bibia also take me to court esan so ni so mi ni obi a obeka m'asɛm ayɛ de ama me na wayɛ me life miserable sisi ampo ama madane beggar nti no menni sɛ woyɛ awofoɔ bi woyɛ papa bi na wo ne ɔbaa etimi fa nyinsɛn ɛwo na ɔbaa no fa ne ho in condition say na wotimi dwane gya akwadaa no sɛ akwadaa no ankasa nkorampo no ɛbrɛ ɛsiane sɛ ɛtɔda bi nea ɔpɛ no mentimi nya ɛmfa mma no na ɔno nso ho ayɛ den atɔ no nti ɔhaw nko a ɛna yɛ mothers no yɛfɛ mu nti CP mothers no yɛnkɔgye akwadaa no mfiri nsuo biara hɔ na yɛakɔgya ne kwan ɛyɛ adwem yɛ aweɛ ɛna ɛma ne ba se ɛna mostly no susu no ɛyɛ delay ɛna ɛma ne ba se nti yɛsrɛ mo sɛ mo ho yɛ ba bi mu se a monkyerɛ mo ɔdɔ mehia mmoa paa mebrɛ si ampo no mehu nea mefa mabrabɔ nyɛ sɛ mehu mpo sɛ o yɛka sɛ meyɛ mada kora mpo a mentimi obi bisa me mpo sɛ mewɔ ba kora mentimi nka sane sɛ mɛkyerɛ sɛ mewɔ ba bi sei no na nipa no ɛmpɛ sɛ ɔbɛbɛn me na ɔbɛtwe ne ho afiri me ho na ama mabrabɔ ayɛ basaa nti mesrɛ mo mehia support susu nti na ɛbɛyɛ a mɛtumi de ahwɛ akwadaa wei sisi a ne mfie a wadu no onya school a ɔbɛkɔ which a ɔbɛtena mu kora mpo no ɔnni bi ohia saa support ne nyinaa nti mesrɛ mo Ghanafoɔ mo hu yɛ mo na mo mboa yɛ na mo so no mo hu sɛ yɛ no yɛnyɛ nipa bi a yɛ mma no mo hu yɛ hu sa meda mo ase.
Today actually we've come to do a medical screening and also offer assistance in terms of medicine and also lifestyle changes or behavioral changes for children with cerebral palsy. Diet is a cornerstone for their health and well-being, and we can't do away with diet when it comes to conditions like this, because when we do away with diet, it affects their weight, it affects their growth, it affects even how the brain that we are having issues with function. And so diet becomes an integral part of administering healthcare to them. What we want to encourage parents to do is that there are dietitians all over the country, nutritionists also. Let us see them, especially for those who have given birth, so who are doing exclusive breastfeeding. There are people who, maybe for that period of time, they see that, my child is having this CP, or doctor have diagnosed my child of having this CP, then the woman feels shy of going to the health care center to seek for help. I want to encourage all mothers and all caregivers that let's go for this weighing or the CWC section to weigh our child to see the growth of the children and also take advices that they have been given to us. Let us not just give our child anything anyhow. And as I indicated during the talk, there are certain micronutrient deficiencies that we should be very careful. For example, calcium microdeficiencies in iron, folate, magnesium, phosphorus. So let's inculcate all these things as I gave examples during my talk in this our foods, and let's take time. Let's give time for the children. Feed them so well, So it's not about you making the child becoming a burden to you. Let's get time, as we always advise you during breastfeeding period and complementary feeding period. Let's get time for these children and make sure that we are treating them so uniquely and giving them the best that we can. And we know that the child can be as strong as we want to. We know CP children who have gone to school, who are doing so well. And so let us limit ourselves just in the room, but do so well in giving the best to the children.
As a funding partner, what informed your decision to partner the Cerebral Palsy to organize this event?
Okay, so I'm not the boss to talk about this, but I would say a little. Gold Coast Medical Foundation is known for their charitable works, especially to vulnerable people in vulnerable areas.
Thank you for watching Nation One TV. Kindly subscribe for more news updates.